We've got, I tell you what, some great thinkers at our table this afternoon. We're going to let them think. We got some questions going to make them think. Maybe you have a question, because in just a few minutes, we're going to go out in the audience and take questions from you. Good afternoon, everybody. I'm Aaron Bean. I'm a senator from Jacksonville, also involved in healthcare, and so it's fitting that I get to moderate today's discussion on healthcare innovation. There's so much happening in healthcare. How are we implementing all the changes from managed care to the Affordable Care Act? We're going to talk about it. We're going to put our thinkers to the test. Now, here's the interesting thing about this afternoon. I have prizes for every single person in this room. I've also got bonus prizes for our panelists today. I'm going to be awarding points for every response, for every question that I ask, questions that you ask. In fact, I'm going to give you points, the audience points, for an innovative question that I'll go out and see you in just a few minutes. So if we can get collectively 300 points, 300 points is the amount we're looking for, then everybody in this room on your way out is going to get, how about this? Not just one, but 2 candy bars. And then for our panelists, and by the way, if you disagree with one another, well, we're going to reward that with 10 points. So if one panelist says something and you disagree with the other person, 10-point bonus. How about that? So, and if we do also, guys, get to 300, then I've got special bonus prizes. I've got a box of moon pies for each of you. How about that? So what great things that we're going to do. So much happening in healthcare. Senate Health Policy is what I chair in the legislature, and it is a rocking place, from telemedicine to you name the issue of healthcare, we're dealing with it and talking about it. So today we're going to talk about innovation and implementation. I've got 3 spectacular panelists that are Jason, Audrey, and Rich. I'm going to let them introduce themselves as we go forward. So from the CEO of Sunshine Health Plans, Jason Delamitros. Jason, tell us about yourself. Where are you from? What do you do?
Thank you. Can this on? Can you guys hear me? Thank you, Senator Bean. Always enjoyed getting moon pies as a prize at a healthcare conference. I'm Jason Delamitros of Sunshine Health. We are the largest Medicaid health insurer in the state, so we have the opportunity and privilege on behalf of the taxpayers in the state of Florida to administer Medicaid, long-term care, Healthy Kids, and a number of other products in the state of Florida in all 67 counties. So excited and thrilled to be here today.
Great job, and 5 points for a great introduction. Miss Audrey Brown is the brand new CEO of the Florida Association of Health Plans. Miss Audrey, welcome. Tell us about yourself. Where are you from?
Thank you. I'm actually from Jacksonville too, Senator, but I've lived
2 points right there.
There you go. There you go. There you go. I thought that would work. I have lived in Tallahassee for several years, and I had just joined the association about 3 months ago, and that's the Florida Association of Health Plans, in case you don't know, is made up of the majority of our health plans in the state of Florida, and I'm just glad to be here today to talk about some of these innovative issues and meet with you.
Very good. And think that we're going to do some thinking. We want to, you pay top dollar to come to the conference. We want these folks to leave with some meat. How about that? And we saved the meat for the last part of the day. Rich Libretto is CEO of Florida Healthy Kids. Rich, welcome. Tell us about yourself. Where are you from?
Well, I'm down from Tallahassee. Our offices are in Tallahassee. I am the executive director of Florida Healthy Kids. We're a partner in Florida's Kid Care program. I will be directing a lot of comments. I have some messages I do want to share with you about Florida Kid Care. I'm feeling tremendous pressure because I really want a box of moon pies. So.
All right, very good. They're here. They've been sitting in my car, so they're icy cold. How about that on the way down from Jacksonville today? All right, let's kick it off right now. Our first toss-up question. The PPACA looks like it's here to stay for now. Your thoughts on implementation and the greatest challenge dealing with it. So the Affordable Care Act is here for now. What's the greatest challenge dealing with, and what are your thoughts on it? Audrey, start us off.
Sure. I think that one of the things we hear most often is there's so much uncertainty still, and what's going to happen. We've seen delays in implementation. So, you know, in the insurance marketplace, certainty is you know, paramount, and we need to have more certainty. So I think that one of the biggest issues for the health insurers and that I hear is it's just uncertain right now, and things are still changing. The other piece, too, is some of the fees and taxes that are included with the Affordable Care Act implementation. It's creating issues and premiums going up, and so, of course, health plans are trying to work with employers and figure out better ways, maybe wellness programs, different things like that, to help reduce premiums to kind of compensate for that.
Very good. Now, is it, it's scary for individuals out there. Is it scary for health plans? Jason?
Yes. Yeah, I would say it is. I mean, I think I agree with everything Audrey said. I think the other thing that's created a lot of uncertainty is what the price of services should be. So PPACA mandates Medicare payments, for example, to primary care physicians, but there's a whole lot of other pricing that's unknown given the newness of the product, given the uncertainty of utilization, and so there's a very vibrant discussion in the industry of what should hospitals be paid, what should DME be paid, what should physicians be paid, and that's creating a lot of uncertainty, frankly, and so that's something that's going to need to be worked out over the next 2-3 years.
All right, so you agree with Audrey then. Uncertainty is its greatest, is the greatest hurdle right now, uncertainty?
Yeah, absolutely. I mean, there's some very simple things. So the way it works, the way the marketplace works is you get an enrollment file of who your members are going to be, but you don't know if they've actually paid their premium or not until the 15th of the month. So actually having an understanding of how many members do we need to serve is you know, a moving target, and we're working through it, and it's early in the process, but it you know, has created a lot of uncertainty in terms of our operations, our staffing, you know, everything we need to do to run a business.
You get 5 points for your answer, but you could have had 15 had you disagreed with Audrey. But you know, some folks say the big insurance companies are the ones that got us into this mess anyway. They're the ones that lobbied for the bill. They're the ones that created it all, and now we don't want to hear them whine. What would you say to somebody that said that, Jason?
I agree. It's always the insurance company's fault. No, I mean, yeah, we're you know, the insurance.
That's worth 10 points right there.
Yeah, no, I think it's you know, an industry that's very easy. There's a lot of complexity. It's very easy to blame the insurance industry for all of our problems. But there's a lot more that obviously transpired in terms of PPACA, and certainly the implementation was not anything we had to do anything with. And there was a website that didn't work all that well a few months ago. So.
Right.
Is it working now, may I ask?
Yeah.
Right. So very good. So uncertainty, it's a challenge not for individuals, also a challenge for companies. Rich Robledo running Healthy Kids, you're kind of plugged in and putting kids under coverage policies. What are your thoughts on the Affordable Care Act?
Well, I would like to try to score some points by disagreeing with Audrey, but
10
not
points
necessarily.
Right there. Disagree.
I don't know whether it's our biggest challenge or perhaps it's our biggest opportunity, the uncertainty. I listened to Dr. Keckley this morning talking about his projections that within 5 years we're going to see the Affordable Care Act modified. We're going to see a lot more state involvement in the design of how we're going to deliver health care to Floridians. And so I'm optimistic that if his projections are correct, we can do some things with the Affordable Care Act to make it work better for Floridians.
Is it going to take a new president to do that? Or is it going to take time? Or is it going to take just the bill collapsing because young invincibles aren't signing up for the program?
I don't know that it would require a new president to do that. It certainly would help to have a new president who would be more interested in making some changes. But I do think that the legislature the federal legislature has, as you suggested, accepted that it is the law of the land, and maybe they're going to look at now finding ways to make it work.
Very good. Is will it collapse eventually? If you have a crystal ball, Audrey, you think it's going to collapse on itself? I mean, everything that I read and see says that it's not sustainable. The numbers coming in, it's the older folks that are very heavy users of health care, the ones that are going to go, they're signing up, the people that are ill, the people that are that do have heavy-duty pre-existing conditions, not that that's bad or anything, but that's the way the model is working. They're signing up, but the young invincibles, if they could sign up on a working website, they're still not doing it. Will it collapse on itself? Audrey.
I would like to say yes. And one of the things that I'm still surprised about to this day is there isn't more uproar from people who are being forced to buy a product and from individuals who are, young invincibles, as you call them, who are going to have to buy a product that maybe they shouldn't have to buy, and they get to subsidize everybody else. So I don't think that's really an American concept, and I think it probably will.
All right, what do you say to that person that says, well, the health plans are the ones that got us into this mess anyway? It was health plans that did it. What do you say to them? I mean, that person is right on the hallway out there. He probably can hear you if you speak loudly in the microphone. Plus, you'll get 10 points for doing it. What do you tell him?
It was the administration, and obviously some of the health plans were advocating for it, but I really firmly believe that this was a goal of the administration with or without the support of the health plans.
Very good. Okay, is it salvageable? Is it how about this question? How about this? And you can't say this because Florida already did it. Everybody says, well, it's some great aspects of the Affordable Care Act. You can now have a kid on their parents' health plan. Have you heard that? Until they're 26. Tom Feeney's heard it. Until they're 26. But Florida did that prior to the Affordable Care Act. So we already have that. What's good about the health law? What's good about it? Tell me something good. Jason, what do you got?
Well, I do think there's a number of people in Florida who don't understand the coverage they've had. So there are, for example, discount plans that are available, and people thought that was health insurance, and then if they got sick, they in fact didn't have insurance. So I think it has forced a certain level of risk management for your healthcare costs, and a lot of people thought they had it and didn't. So, and I think the other thing it's done is it's brought healthcare to light. I mean, we're talking about healthcare almost every day now, and 3 years ago, health insurance wasn't that interesting of a topic. So I think it's elevated an important issue and given some people coverage that they thought they had and maybe didn't.
All right, so the discussion is out there. Audrey, what's good about it? Do you disagree with Jason for 10 points?
I do disagree. I don't think there's anything good about it.
50 points. Rich, what do you thought? Rich, what's good? I mean, and I know you're in a kind of a different world because our mission is to cover kids, and I'm with you. I've got a heart to cover kids as well, and it's working. It's working. What you're doing is working. Do you see some bright spots in the Affordable Care Act that we could use? And
I think what's good about it is we saw the success, or we see the success of Kid Care, where we helped some people purchase coverage. We started Kid Care with the idea that we wanted to provide coverage or an opportunity for working families to be able to afford health insurance, so we gave some federal and state subsidies. I think there's probably some good in the Affordable Care Act's attempt at doing that. I'm not sure I like the way that they did it. I'm not sure that I would agree with the essential health benefits and defining what it is that people should be purchasing. Yeah. But conceptually, the idea of maybe providing some help to working families to be able to afford to cover them is the good side of it, and I'm stretching.
All right, very good. 20 points. How about that? Rich Vallotto on the board in a big way right there. Okay, here we go. The legislature, and I'm part of the legislature, sometimes doesn't get it right. Sometimes we mess up. Sometimes we do a bill and it doesn't cover the what we want, and we have to do a glitch bill or a son of a glitch bill or all kinds of things to get it right eventually. One thing that I want to let you know, I think we can all say, legislature, well done, and that is passing. We took a pass on one of the options to run our exchange, run the exchange, and that has just been a disaster. So well done, legislature, on taking a pass and sitting on the sidelines. My mom would say we would go to the fair, and all those games always looked so inviting. In her rule, we had to watch 5 times somebody play the game before we understood it, before we were able to donate our money to the fair guy. So, with that being said, we still have some problems. The website's not working, but how has it been to put your products out there on the website? How's that working for you as a health plan? And do you see it getting better soon?
Yeah, I think it's working now. I mean, it's the launch, as you mentioned, had a lot of problems, had a lot of issues with volume, but for all intents and purposes, the plumbing of it seems to be working fine. I think there's a lot of uncertainty around pricing, a lot of uncertainty around risk, so not clear what types of individuals are coming in and if they're going to be higher or lower risk. But the blocking and tackling is working, and I think I would have a little bit more optimistic view than my counterpart here, just trying to win the mud pies, but. We're in the first month. We're in the first month of it. The moon pies. We're in the first month of it, and I think it's going to take a long time to get sort of the kinks worked out. It's a massive program that affects a lot of people.
Very good. Any other thoughts on the website and the exchanges? We're going to have that same choice, whether or not Florida participates in the exchange process, running our own or punting or joint venture. And I think it's easy this year. We're all going to sit back. I think it's going to be a lot easier. Last year, Rich or Audrey, any thoughts on the site or how it's working, or your thoughts on it?
I'm not overly surprised that they had issues with the website going up on October 1st. So many transitions, so many new systems have problems like that. But I think it was critical to the success of the program, as we talked about, getting the young invincibles out there, with a short amount of time for people to enroll. I think we invited anti-selection. I think that it gave the Affordable Care Act a more bad name, if you will. I don't think it did anything to help enroll the people that they were trying to enroll, the young invincibles.
Very good, very good. Now, ladies and gentlemen, I'm about to go out in the audience where you can score big points for the team with your innovative questions on healthcare, on innovation, and we're going to talk innovation. I've got another question for them, and that is, it's a big day today. If you're in managed care in Florida, big day, because today is signing day. A lot of the plans are signing with AHCA today on as they anticipate rolling out managed care, or the continued rollout of managed care. How is managed care, the rollout? How's it going, Jason?
Yeah, I can talk a little bit about that. So we're halfway done. So I don't think we can call success yet, but it's going well, and I think. And for long-term care right now, we have 7 of 11 regions up and running, and that's going well. And then we're about to commence enrollment for the Medicaid, which starts in May. And I think from our perspective anyway, what's worked really well is have lots and lots of communication between the association, between the agency, between our political leaders, between our providers. And the more communication we've had, the better. And I'd say for all intents and purposes, for such a large program, it's gone very well in Florida.
Very good. Audrey, your members, what are they saying about managed care rollout? How's that going?
I think everybody's excited for it to begin May 1st. I think that everybody that I've talked to is really appreciative of the transparency in the process, as well as, right now the contracting pieces, the draft contract came out, and we had the opportunity to engage with the agency to talk about any concerns we've had. So there's just been a lot of collaboration and coordination, and that's been exceptional, and I hope and believe that that's going to make it a successful implementation.
Very good. Not without some kinks, I guess, but we're still plowing ahead. Rich, your thoughts on...
I'm not as involved in the movement to the Medicaid managed care, but Audrey mentioned the contract, and I am aware that the new contracts have gotten rid of an awful lot of the bureaucracy or red tape that used to be attached to the health plans in terms of their ability to help people enroll. So from that perspective, I think it's going very well, and I'm pleased to see that the agency has done that.
Very good. Now, ladies and gentlemen, it's your chance to be a star. If you have a question, if you'll raise your hand, I'll come see you. Healthcare innovation, and we haven't talked innovation, but panel, an innovation question is coming, whether the audience ask it or I ask it. Thoughts on, we have our first question. Here we go, with points on the line. Very good. Okay, it's 10 points. And this is Rose Naff. She's CEO of Florida Health Choices. Rose, welcome.
I just want to make sure the audience gets some of these points, so I'm stepping up for you.
Go right ahead.
2 thoughts or questions or challenges. We talk about the young invincibles, but we know that children are even less expensive. So would anyone care to predict when we're going to let children rejoin their families in the healthcare system, not put them in a separate system like Medicaid or SCHIP, or are we forever going to keep children apart? And the second question or comment is, would anyone want to talk about, because we know from when children came uninsured into the Healthy Kids program initially, there was pent-up demand, and it was usually resolved within the first 90 to 120 days. I suspect we're going to see similar pent-up demand from previously uninsured adults. So if anyone wants to comment about that, I'd be interested too. It's probably too early to say you're seeing any pent-up demand, but I think we're all probably expecting it.
I mean, I can handle the, hi Rose, good to see you. I can handle the second question probably. I mean, for our own experience, we haven't seen it yet. So if it's there, we haven't seen it. Things have actually gone a lot smoother than we anticipated in terms of enrollment and what we expected in terms of demand for services. So if it's there, we haven't seen it. In terms of the first question, maybe Rich, you can.
I don't know that I can speak to when we're going to put the families together with the children in Medicaid. That is the Medicaid expansion, which I think we've pretty clearly decided is not something that we want to do, but we may have opportunities to do that with an alternative to Medicaid. I think the Affordable Care Act did allow for families to get together with their children who were in the CHIP program, but for whatever reason, the federal government decided that they would delay the implementation of that for at least a year. The Affordable Care Act did include a thing called the Basic Health Plan, and basically what that was an opportunity for the moms and dads to enroll in the same program with their kids who are presently covered by CHIP. But as I said, for whatever reason, the federal government put that aside until at least next year. Those are the kind of things that when I mentioned earlier that I hope Dr. Seckley is right that we will, or Keckley is right, that we will be able to have more opportunities at the state level to choose how we want to cover our families in Florida. We'll be able to do things like that, Rose.
Yeah, I mean, I would say, for companies like mine, and there's a number that are in the industry, we have a deliberate strategy to be able to cover individuals at multiple points of income level. So if someone's in Medicaid for a period of time and maybe they go up in the income stream and so then they qualify for affordable care product, or they're elderly and spend their assets down and go into long-term care and are also on Medicare. So there's companies like mine and others, our goal is to be able to cover folks at all levels of their income so that they can have the same doctor, the same network. If they're in a disease management program, they can stay enrolled in that. A great example are moms who become pregnant, become eligible for Medicaid, but then fall off eligibility 2 months later. We want to provide them a full continuum of products so that they can stay with us if they desire for their health coverage. So I think the industry is trying to respond to some of the problems that you're bringing up by offering multiple products that can cover people wherever they are.
Very good, very good. 20 points. How about that? Rose Knapp, 20 points question, 10-point response. Well done, panel. And our audience question. Next is John. John, tell me your company, and I know you work here in D.C. and all over the place, so tell us.
John Ralston with Armory Hill Advocates, and one of the questions that I had for you, I'd love to hear your thoughts around the changes in benefit design as we're seeing through Obamacare across the country, and the interesting piece of looking at employers capping their liability somewhere around the 10,000 mark. So looking at high deductible plans, are those here to stay? What do you think?
Who wants it?
I'll attempt it.
Go for it.
I think that we are going to absolutely have to see those kinds of plans in place, because affordability is key. And I know this is called the Affordable Care Act, but it's not necessarily going to be affordable. And so we are seeing all kinds of innovation as well with how employers are responding, health plans are responding on rates and on premiums, and ways that they can do things, again, like wellness programs and such to kind of counteract some of those increases for fees and taxes, and for having to cover all comers and different things like that.
Is sticker shock coming, though? It seems like those high deductibles, holy cow.
Yes.
And 8,000, 9,000.
Yeah.
America's in for a big shock.
Agreed.
I mean, I think one thing that I think the Affordable Care Act has done is it's brought to light to most people how much healthcare costs. I think there's a lot of folks who didn't understand how much it actually costs, and now they go and look and they say, "Holy cow! It's $490 a month just for me," or whatever it is. And I think that is shining a light on a big problem. Employers have known for a long time how much it costs, But I think one of the things this has done is force people to know how much their healthcare really costs and to look into alternatives and innovate.
Very good panel. Well done. 15 points. John on the board, 20 points. How about that? And now I'm with Ron Johnson from PNS. Ron, what's your thought or question?
You basically just stole my question, but let me say what it is. Throughout this whole debate, it's always been the issue, is it affordable? Is it going to be affordable? If the premium is too high, or is the deductible going to be too high? So you really, what are you offering the young invincibles? My son, who's got a young family, when he looked into it, number one, the website didn't work. Second time he tried to go on the website, he had someone guiding him through it, and that person couldn't get it to work. But beside that, he still realized that it was unaffordable to him and his family, either on the premium side, or if he did get a low enough premium, he couldn't afford the deductible, so what does he really have at the end of the day? And are there insurance policies out there that you think will become affordable? Or is it just we're just talking about providing health care to everyone?
Yeah, so I can start because it's generally the insurance company's fault, and then we can, move on. So, at least as the program, that program and others launch, there's a number of variables that we can generally play with around healthcare costs that we're unable to play with. So the benefits and the product design of what qualifies for a product that can go on the exchange is fixed. We can't change that. The benefits are fixed. Generally, the required network and the providers who need to be in it is fixed. And they want a certain amount of money to participate, or we have to pay the Medicare, which is mandated by the ACA. So, I think to start out, the things that you can use to tweak costs have not really been available. However, I think on a go-forward basis, there's lots of opportunity to innovate. I think you'll see new players enter the market. I think hospitals and managed care companies are going to have to find more interesting ways to contract that are more episode-based versus fee-for-service. And I think there'll be a number of providers who roll out things like telemedicine and other delivery mechanisms that will lower costs. So I think short answer is in the short term, not yet, but in the long term, I think there are opportunities for costs to be lowered.
And may I take one kind of just a step back with this? I think for your son and for others, before they even went on the website, they probably would have liked to have a little bit of information and maybe even be able to see what subsidy they may be eligible for and those types of things. And I just wanted to point out that that was not available either. So again, there's uncertainty and it's been an interesting process.
And if I may, I'd like to refer back to your sticker shock. I do think that people may not realize what it is that they're purchasing. This silver plan that is the basis for tax credits covers 70% of the expected cost of an average policy. That leaves 30% in the hands of the family. So not only do they have the premium to look at, but the 30% cost sharing, I think, is going to be a surprise.
It's going to be a challenge for sure. Hey, that's a great question. Ron, thank you. You still get 25 points. Panelists, another 10 points. Well done. I'm on the front row now. I'm with Tamara Demko with Florida Tax Watch. Tamara?
Thank you, Senator. We have heard a lot about the individual level, but on a more macro level, the funding sources for subsidizing have been disappearing very rapidly. We have Cadillac tax and waves of pain coming with employer taxes and pharma taxes and medical device taxes. Is that going to be enough to cover the subsidies long-term for sustainability? That's the first part of the question. And if not, how can Florida prepare? And second, is there anything to innovate there, in other words? And secondarily, we don't really pay Medicaid providers very well. Physicians don't like to even be told or let people know that they are Medicaid providers for that reason. But I've heard that the exchange rates in certain places have already come out, such as Connecticut, and they're actually far below what were expected. So is the exchange, is the bronze plan, is it just really the same lowered Medicaid payment renamed? And if so, are we heading for disaster?
Yeah, so I can handle the second part of the question. Hopefully you guys know the first part. So two things with respect to reimbursement. First, under the ACA, most primary care physicians have to be paid Medicare. And those funds came from CMS, distributed to the state of Florida, and then they pay us, and then we pay those physicians. And I believe there's 2 years on that in terms of how long that'll be in effect. Going forward past that, the legislature, in its wisdom in 2011, passed reform. And as part of that, they encouraged, ACA encouraged the health plans that were awarded Medicaid to pay higher market rates. So in fact, companies like mine and others in the industry, we actually reimburse at a much higher rate than Medicaid when there's a value proposition. So we align to patient-centered medical homes that have IT capabilities, that demonstrate outcomes in lower ER, demonstrate quality. And so if you're a Sunshine primary care physician, you have an opportunity to make more than Medicare if you comply with certain operational needs and quality incentives. And so, I think what's going to happen is you'll see two different sets of reimbursement. Reimbursement along the lines of the providers delivering value, and that will be enhanced, and then the providers who maybe aren't interested in that or aren't as capable, and yeah, their reimbursement will be less.
I'm not sure I ever believed that it was going to be sustainable in the first place, the Affordable Care Act, and that the various taxes and the fraud recovery from Medicare, et cetera, was ever going to fully cover the cost as was presented by the federal legislature. I think the fact that we have delayed them, you are right, is going to cause more problems in terms of the overall cost of the Affordable Care Act. It's a federal issue primarily, however, rather than the state.
Very good. Tamara, well done. 20 points. Panelists, 10 points right now. We are now going to enter what we call the lightning round. The lightning round is a series of rapid-fire questions for our panelists on a variety of different subjects. It's a great way to see their inner thoughts because they only have 4 seconds to respond.
4.
We'll then follow up with closing statements and then something innovative about this year. Again, we want to give some folks some meat to take home with them. So, and we'll be, and I'll also announce the final tally, how close we are. I'm expecting a text from my accountant who's in the back of the room, keeping tabs on all our points. So, here is our lightning round, series of 10 questions. If you don't know the answer, you can pass, but you get minus points if you pass, so better to go with your gut instinct right now. Okay, here we go. Number 1. Is it slim or is it none? The chances of Medicaid expansion passing the Florida House. Jason?
None.
Audrey?
None.
Rich?
Slim.
Very good. The greatest basketball player of all time. Audrey?
Michael Jordan.
Rich?
Dr. J?
Jason?
I'm going to go with Jordan.
Jordan's the correct answer. Who will be the Republican nominee for president in 2016? Rich?
I'm sorry, I missed the question.
Who is going to be the Republican nominee for president in 2016? Rich?
I'll take it.
Pass. Minus 3 points. Jason?
I'm going to go with Chrissy.
Audrey?
For president?
For president.
Jeb Bush.
Jeb Bush, okay, very good. I don't know who the answer is, but it's not going to be Christie, so minus 2 points for Jason. The best way to decompress after an extremely hectic day dealing with health care. Rich?
Scotch.
Jason?
Tequila.
Audrey?
Red wine.
Very good, all correct. 10 points. What is the best way to refund an estimated $500 million surplus in the 2014 budget? Is it lower vehicle registration fees or longer and more sales tax holidays? Jason?
Sales tax holidays.
Audrey?
Sales tax holidays.
Rich?
Unfortunately, I can't argue. I agree.
Very good. Correct answer, all of the above. Oh. Ooh. Greatest movie of all time. Audrey?
Goonies.
All right. All right, 5 points for fan favorite right there. Rich?
I don't see all that many movies, but I saw Frozen over the Christmas holiday and loved it with my grandchildren.
Very good. Minus 10. Jason?
The Godfather Part 2.
Very good. All right, there you go. Okay, on a scale from 1 to 10, 10 being absolute lunacy, how crazy is it that the Jacksonville Jaguars did not draft Tim Tebow? Audrey?
10.
Rich?
Crazy.
What was that?
Why didn't Jacksonville draft Tebow?
Didn't they?
Yeah.
I agree with them not drafting him.
10. Okay, very good. Jason?
I'll say 10.
10. Correct answer, 11. Y'all were close. Okay, Barack Obama has stated his priority is immigration, as has the Democratic Party. How many days until the Republicans cave? Jason?
I say 0. They're going to hold.
Very good. Audrey?
I'd like to agree with that.
Very good.
No caving.
No caving. Okay. They're the unknown question right there, which is good. How close, you don't have to pick the winner, but just in percentage points, how close will our November election for governor be? How close will it be, Audrey?
6 points.
6 points. Rich?
5.
5. Jason?
11.
11. Less than 5 is the correct answer. And our final question, Seattle Seahawks or Denver Broncos? Rich?
Broncos.
Jason?
Denver.
Audrey?
I'm going to just disagree and say Seahawks.
Very good. Congratulations. Congratulations right now. So let's total up the points right now. We needed 300 to win. And right now we are at 289. We're very close. So now it's time to woo the audience with your closing statements. Something innovative. What's something they can take with them this year? What are we looking at this year? What's a prediction you can make on what's going to happen this year in healthcare? What's something that's innovative that these health executives and people that are in the healthcare business can take with them? What's a nugget we can throw their way? Audrey, start us off. What do you think?
Sure. I actually wanted to bring up something that I'm kind of seeing as a trend, and it may kind of sound geeky because I'm going to talk a little bit about rating. But one of the things that we're seeing some of our health plans do in the large group market is actually to go from the traditional way that they rate with on experience from the prior year to a retrospective rating, which is giving employers the opportunity to put in wellness programs, do different things to save money, and they're actually basing the premium based on the actual experience during the year. So that's sort of innovative, and that's a way for employers to really have more skin in the game, but also to have savings potentially from doing good work and managing their claims. And I think that's a trend we'll see.
Very good. Other thoughts? What's your wish list? One bonus question to Audrey. What's your legislative wish list? What's your number one that you want to see the legislature do in health? Maybe it's telemedicine. Maybe it's something else. What are your thoughts?
I would like to say I hope that there is nothing done to the managed care expansion. I hope there's no bills, nothing that passes. But then I also would like to, we would like to see some telemedicine. Absolutely, and the plans do support that. We will be supporting it, and we'd like to see it done.
Very good. Okay, Audrey Brown. Now, Rich Roberto, what are your thoughts? Something innovative, your predictions, and your wish list.
Well, mine is not necessarily innovative, so I may lose points, but I think that I wanted to send a message to the employers in the audience about the possibility of kid care being of benefit to them. Unlike the exchanges, kid care does not prohibit you from coming or obtaining subsidized coverage if your employees have access to health care. So any of your low-level or low-income employees could come to kid care and could take advantage of subsidized coverage. Those who fall into the family glitch and can't get into the exchanges for subsidy, I think they should also come look at the Kid Care Full Pay Program. So as you're dealing with your employees, that's the message that I wanted to make sure that you were aware of. Many of us think of Kid Care as something that is just for low-income individuals, but many of your employees' children may benefit from the Kid Care Program.
How do we find out more? Say they want to, say they buy on it. How do they kind of secretly find? Is there a website they could go to?
There is a website called FloridaKidCare.com. It's hard to remember, Florida Kid Care and then .com. But yes, and they can identify or get any information that they want right there.
Very good. And that's something, too, not just for your employees or anybody, really anybody, a friend or a coworker that has a kid. Everybody should have coverage. There's no excuse for not having coverage in Florida with that Kid Care program. Affordability is not an excuse anymore. What's your top legislative wish for this year you'd like to see? The legislature do in health care? What's something?
You know, I had it a minute ago and I got all distracted.
All right, we'll come back to you.
Okay,
we'll come back.
thanks.
Jason, take us out of here, my friend. What are your thoughts?
Sure. Most people don't know this, but there's 30,000 kids in Florida in the foster care program where the state is their legal guardian. And the state has moved their healthcare costs into an integrated managed care platform. And I think by the end of the year, Florida will be viewed as the most progressive and innovative foster child healthcare program in the country.
Very good. Thank you. What's
sorry.
your legislative wish? Back to Rich. Rich, what are
I'm
your thoughts?
sorry, and I'm back. And what I wanted to do was I wanted the Florida legislature to do anything that they can to actually address the problems of healthcare, which is the unsustainable costs. So things like Audrey talked about with telemedicine, anything we can do to really address healthcare costs, I think would be on my wish list.
Yeah, and we would agree. We love the innovation, the ideas that to allow the industry to change and evolve and innovate, but not making large structural changes. There were a lot of changes that have been made over the last 2 years. We need to kind of let those be implemented and then adjust them once they're done and we can see how well they're working.
Very good. Are we going to see a prediction of savings from our managed care rollout? What would you guess? Is that too big of a question? Because right now you're at 297 points. So we need a good answer. We need a good answer that's going to make everybody erupt in applause and throw you over the top because everybody's going to win a candy bar if you can nail this one. Jason.
In the wisdom of the legislature, when they passed reform in 2011, they built that in day one. So the savings will happen day one by the architecture of the program and the law that was passed. So yes.
I'm sorry, I don't understand what you just said. Does that mean that
yes,
we're going to see big savings?
Yeah, they're built in already. I mean, the state gets them on day one based on the way the program was set up. So absolutely.
Very good. 4 points, 301 points, ladies and gentlemen. Let's give our panelists, because they have done a great job putting up with the antics of this afternoon, and congratulations to you, ladies and gentlemen. Each and every one of you gets to pick 2 candy bars. Now, somewhere back there is my legislative aide. They're right there. He's pointing. So there's 2 big baskets of candy. If you want to pick a couple, take it with you. That is absolutely fantastic. I've got moon pies for our panelists. Want to invite everybody. I think everybody's going to be in Tallahassee this legislative session. Want to salute AIF for all the leadership they do to bring a focus on healthcare. Sometimes healthcare is not the topic that everybody wants to talk about, but it certainly is, I tell you, it's a driver of costs, it's a driver of our quality of life, and if we don't get cost and under control, then our quality of life is not going to be very high at all. So with that, ladies and gentlemen, I wish you a great afternoon. We stand adjourned. I'm going to give, somebody's got a camera, we're going to get our panelists accepting these moon pies. Y'all have a great day. Thank you so much. We stand adjourned.